So in the first question, it has been given that a nurse observes as a child with Duchenne's muscular dystrophy attempts to rise from a sitting position on the floor. After attaining a kneeling position, the child walks his hands up his legs to stand. The nurse documents this as which of the following? So in these questions, we have been given that a nurse observes a child. Okay, so a nurse is observing a child who did an activity like he is trying to stand from a sitting position on the floor. So what he does, after attaining a kneeling position, the child walks his hands up. So firstly, he is using his hands to walk. Then steadily and slowly, he is using legs to stand. Now, this activity is commonly seen in child with Duchenne's muscular dystrophy. So, patients with Duchenne's muscular dystrophy are seen to do this while standing and walking. Now, the nurse is observing a child and what she has to document that what is this sign. So, we have to tell that which sign indicates that this activity is being done. So, option number 1 is Gale-Azzi signs. Option 2 is Goodell sign. Option 3, good enough sign. Option 4, Gower signs. So to solve this question, we have to first understand what is Duchenne muscular dystrophy. So in previous video, we have already discussed about this disease. So this is a kind of muscular dystrophy in which there is muscular weakness. Okay. The main important thing of this disease is that it is a X-linked disorder. So it is transmitted by mother to the baby through the X chromosome. So it is inherited by the mother to the baby, and mainly it occurs in the male. Okay, male baby. Why? Because male has only one X chromosome and he can't be a carrier. So he will surely get this disease. Okay, so Duchenne muscular dystrophy is a muscular weakness and it is a progressive disease. Okay, and it has no treatment. Okay, it does not have any treatment. So this is all the important things about this condition. Now, what is the sign we have to tell in this question? So first, let's see what is Gale-Azzi sign. So, Gale-Azzi sign is elicited by placing the child supine with both hips and knees flexed. An inequality in the height of knees is a positive Gale-Azzi sign, and usually it is caused by hip dislocation or congenital femoral shortening. So, in the question it has been given that child is trying to stand, okay, and before standing he is using his hands to walk. But Gale-Azzi's sign is that a physician will make the baby lie in supine position, and then the physician will measure the length of the knee. Okay, so if length of the one knee will be greater than the other, it means that there is not a proper alignment. And if there is inequality in the height of knees, it is a positive Gale-Azzi sign. Okay, and it indicates hip dislocation. Okay, so it is assessment for hip dislocation, but it is a Gale-Azzi sign, not the sign that we need to find in this question. Now let's talk about Goodell sign. So Goodell sign is not clearly related to the hip dislocation. Goodell sign it refers to a probable sign of pregnancy characterized by softening of cervix. So Goodell signs mean there will be softening of cervix in pregnancy. A positive Goodell sign occurs due to increased blood flow noticed in the cervix during the first 4 to 8 weeks of pregnancy. So this is a sign of pregnancy. So the cervix will be soft and it will look like this through vagina. This is about Goodell sign. So option number 1 and 2 are not the correct option. Now talking about option number 3, good enough sign. Okay, so let's see what is good enough sign. So good enough sign is a good enough score. Now this score is used in psychiatry unit. So it is a psychological personality and cognitive testing used to evaluate children and adolescents for a variety of purposes, measuring nonverbal intelligence, screening emotional and behavioral disorders. It is a test where the subject is asked to draw a picture of a man, a woman, and themselves. No further instructions are given, and the picture are analyzed on the number of dimensions. So, good enough score is used to assess a person's behavior and emotional stability. So, it is clearly not related to the question and the activity the child is doing. Okay, so this is the example of good enough score. So, the patient will make a male or female, and then we have to give score to the patient on the basis of how he has made the drawing. Okay, so we have to look for the details like arms and legs attached to trunk, legs and arm attached to trunk at correct point, looking at the neck, looking at eyes, if nose is pointed or not pointed, is mouth properly made. So it will tell about the mental age of the baby. So this was about good enough sign. Now talking about Gower sign. So we can clearly see that Gower sign is the sign that indicates, that means that a child, when attempts to rise from a sitting position on the floor, he will attain a kneeling position, and then he will walks in his hand, and then he will use his legs to stand. So let's see through the picture. So this is a picture where the child is sitting, then he is, after kneeling, he is using hands to walk. Okay, now gradually he is getting upward and trying to stand properly. So this is the Gower sign. The Gower sign, the child walks the hands up the legs in attempt with to stand. A common approach used by children with Duchenne's muscular dystrophy, here rising from a sitting to standing position. So the correct option would be option number 4. I hope this question was clear to all of you. Now let's move to question number 2. When developing the plan of care for a child with early Duchenne muscular dystrophy, which of the following nursing goal is a priority? So, as we have already discussed what is Duchenne muscular dystrophy, now we have to tell that when we are developing a plan for a child having this disorder, what nursing goal is our priority? So, option 1 is we have to encourage early wheelchair use, or we have to foster social interactions. Option 3 is maintaining function of unaffected muscles. Option 4, preventing circulatory impairment. So, what should be the priority of the nurse in this condition? So, let's talk about encouraging early wheelchair use. Now we know in Duchenne muscular dystrophy, there is a good amount of muscular weakness. Okay, so muscular weakness will progress with time, that is for sure. Okay, this is a progressive disease. Okay, if we provide any kind of medication and surgery, still the disease would be progressive. So we have to encourage the patient to not use wheelchair early. Okay, patient is a child, and we have to encourage the patient to walk by himself. Okay, to not use a wheelchair as early as we want. Okay, so encouraging early wheelchair use is not the prompt option, it is not the prompt action. Okay, so we have to discourage use of early wheelchair. We're talking about option 2, fostering social interactions. Now, social interaction is very important, okay, in this child. But when the child will lead to social interaction? Only when child will have a good self-esteem. So developing good self-esteem is very important to do social interaction. Now, the main thing we have to focus on that how the child will develop self-esteem by having the good motor function. Okay, so clearly we can see that motor function stability will lead to good self-esteem. So what we have to do is we have to maintain function of unaffected muscles. As we know that some muscles are still unaffected, so we have to promote and maintain functions of those. If we are going to maintain functions of unaffected muscles, then there will be increase in self-esteem of the child, and this will foster the social interaction. Talking about preventing circulatory impairment, so there is no circulatory impairment in this disease. Okay, circulation is proper in the body, so this is unnecessary here. So the primary focus, the priority of our is to maintain function of unaffected muscle. So option number 3 is the priority of the nurse. After this, from this set, the social interaction will foster. Okay, so option number 3 is the correct option. Now let's move to question number 3. When interacting with the mother of a child who has Duchenne's muscular dystrophy, the nurse observes behavior indicating that the mother may feel guilty about her child's condition. The nurse interprets this behavior as guilt stemming from which of the following? So, in this question, when a nurse was interacting with a mother who has a child diagnosed with Duchenne muscular dystrophy, she came to know that mother is having some amount of guilty about her child's condition. Now, the nurse has to interpret that what is the cause of this guilt. Okay, so what is the stemming of this guilt? Okay, so from this option, we have to tell that what is the cause of guilt. First is the terminal nature of this disease. Option 2, the dependent behavior of the child. Option 3, the genetic mode of transmission. Option 4, the sudden onset of disease. Now, we have to clear our concept about this disease. If we have a clear concept about this disease, the choosing the correct option would be very easy. Now we know that this disease is a X-linked disease, okay? X-linked recessive disorder. So what happens? A mother who is a carrier will transmit this disease to her male child, okay? Because male child has only one X chromosome, so the male child will be affected, and this happens in 50% of the cases. In the case of girl, the female will be always a carrier, okay, and this also occur in 50% of the time. Now we know that a mother is transmitting this condition to her baby, so obviously she will feel guilt about this. Okay, so the reason of the guilt would be terminal nature of disease? No. Okay, this will not create guilt in her because it is not her fault about the terminal nature of the disease. Will the guilt due to dependent behavior of the child? Now, child is loved by a mother no matter what, and a mother will put any amount of effort to care for the child. So, dependent behavior would not be a big issue for stemming the guilt. Talking about option 3, genetic mode of transmission. Now, this is an option that we have to look for. Now, we know that mother will have some amount of knowledge about this disease. So, she will surely know that this disease is transmitted by her, and this will cause a good amount of guilt in her. So, this is the reason that will cause guilt in her. Okay, talking about option 4, the sudden onset of disease. So, this disease will not onset suddenly, it is going to onset gradually. So, option number 4 is not the correct option. So, we can understand from this condition that due to genetic mode of transmission, the mother will feel guilty about her child's condition. So option number 3 is the correct option. So let's read this point. Duchenne muscular dystrophy is inherited in an X-linked recessive pattern. Males have only one copy of X chromosome from their mother and one copy of Y chromosome from their father. If their X chromosome has a DMD gene mutation, that is Duchenne muscular dystrophy gene mutation, they will have Duchenne muscular dystrophy. Okay, that's why mother will feel guilt about this condition. Now let's move to question number 4. A nurse teaches the mother of a young child with Duchenne muscular dystrophy about the disease and its management. Which of the following statements by the mother indicates successful teaching? So a nurse gave teaching to the mother about Duchenne muscular dystrophy. She is having a baby having this condition, and about management and about the disease. Now, which statement by the mother indicates successful teaching? So we have to tell from these options that which statements indicate that the teaching has been successful. So first is, my son will probably be unable to walk independently by the time he is 9 to 11-year old. Option 2. Muscle relaxants are effective for some children. I hope they can help my son. Option 3. When my son is a little older, he can have surgery to improve his ability to walk. Option 4. I need to help my son be as active as possible to prevent progression of this disease. Now, from all these options, we have discussed some of the points. So, first point I will focus on, that is from the option number 4. That says, I need to help my son be as active as possible to prevent progression of disease. Now, being active is very necessary here. Okay, being active will make the patient feel confident, and this will improve self esteem of the patient. But talking about progression of disease, so being active will not decrease progression. Duchenne muscular dystrophy is surely a progressive disease. As there is no cure of this disease, so disease cannot be at a stable point. It will be always progressive. So this is not a correct statement that a patient should give, mother should give. Talking about option number 1, that says, my son will probably be unable to walk independently by time he is 9 to 11-year old. So this is a scientific fact. This is a thing that is accurate. So it is true that a child who is 9 to 11-year old having this condition will be unable to walk independently. Okay, so by 9 to 11 years old, the child will not able to walk independently. So this seems to be the correct option. Now let's see option number 2. Muscle relaxants are effective for some children. I hope they can help my son. Now we have to know this fact that there is no medication, no treatment that has been effective for this disease. This disease can be only cured, not cured, but we can provide some kind of relief through the physical therapy only and being active, okay, and maintaining the unaffected muscles. Use of muscle relaxant are not gonna help. Okay, so this will be the not the correct statement. Talking about option 3, when my son is a little older, he can have surgery to improve his ability to walk. So surgery is not a thing that is gonna happen in this condition. Surgery is not performed in Duchenne muscular dystrophy. So this is also not the correct statement. So the correct statement would be that my son will probably be unable to walk independently by the time he is 9 to 11 years old. So this statement indicates that the mother has good amount of knowledge about this disease condition of her child. So option number 1 is the correct option. Now let's move to question number 5. A 16-month-old child is seen in the clinic for a checkup for the first time. So a child is 16 months old and he has been in the checkup for first time. The nurse notices that the toddler limps when walking. Okay, so this is a abnormal observation that a nurse noticed here. Now, which of the following would be appropriate to use when assessing this toddler for developmental dysplasia of the hip? Now we can clearly see that a toddler is limping while walking. So nurse is going to perform an assessment to check if there is any kind of developmental dysplasia of the hip. So if the hip is displaced or not, you have to tell which assessment we have to perform from these options. First is Ortolani's maneuver. Option 2, Barlow's maneuver. Option 3, Adams position. Option 4, Trendelberg sign. So we have to see that what are these maneuvers, and from these which assessment is helpful for the toddler having displacement of the hip. Now let's first see what is Ortolani's maneuver. So Ortolani and Barlow maneuver both are used to check hip displacement. So let's see what is Ortolani's maneuver. So it is used during the neonatal period. So it is used in neonates, okay, in infants to assess developmental dysplasia of hip in infants. With the infant quiet, relaxed, and lying on the back, the hips and knees are flexed at right angles. Okay, so in this maneuver, we are going to tell the infant, we're going to make the infant lie in supine position quietly. Then we have to flex the hips and knees at right angle, at 90-degree angle. Then knees are moved to abduction. So we have to abduct the knees and pressure is exerted. If the femoral head moves forward, then it is dislocated. So here a sound is produced, that is a click sound is heard. So what happens? So this is the picture of Ortolani maneuver. Okay. So what happens here? We are going to flex the hip and knees in 90-degree angle. Then we are going to abduct. Okay. We are going to make the hips and knees abduct. Okay. We will make them far from the center. And if there is click sound produced, then we can see that the femur has been dislocated from the acetabulum. Now, this is not the assessment we are going to perform in a toddler who is having limping while walking. Okay, this is used in neonate. Now, talking about Barlow maneuver is used to assess developmental dysplasia of hip in infants. So it is same as Ortolani's maneuver, but in this, as a femur is moved into the or out of the acetabulum. So what we do here, we try to move the femur from acetabulum. A clunk is heard, indicated dislocation. So what we will do, we will do the adduction, not the abduction. Okay, so we will make the legs close toward the center of the body, and if there will be displacement from the acetabulum, then this is Barlow maneuver. So clunk sound if reduced, then this indicates positive Barlow maneuver. Now talking about Adams position. So what is the Adams position? So Adams position is used to evaluate for structural scoliosis. The child bends forward with feet together and arms hanging freely or with palms together. So it is used to assess structural scoliosis. So we can see in this image when a child is told to bend forward with feet together and arms hanging freely. So if there will be proper alignment, it means there is no structural scoliosis. But we can see here alignment is not proper. There is malalignment, and this indicates structural scoliosis. So this test is used to see structural scoliosis. Now the remaining option is Trendelenburg sign. Now let's see what is the Trendelenburg sign. So Trendelenburg sign in a toddler, if weight bearing causes the pelvis to tilt downward on the unaffected side. So what happens when a weight is beared by the child? So what happens on the unaffected side? The pelvis will tilt downward. So if this side is unaffected, pelvis will tilt downward. Now, instead of upward as it would normal. In this is Trendelenburg sign and it indicates developmental dysplasia of hip. Okay, so if there is proper alignment, this is normal. But if one side of the pelvis is tilted downwards, so when while walking, one side of pelvis is downward and one side of pelvis is upward, and this is causing limping, then this indicates positive Trendelenburg sign. So option number 4 is the correct option, and this assessment the nurse is going to perform in this toddler who is limping. Okay, I hope all the rationals are clear to you. If there is any doubt, let me know in the comment section. Now let's move to question number 6. The nurse is assessing the infant shown in the figure. On observing the client from this angle, the nurse should document that this infant has which of the following. Now we can see that the child is lie in supine position and the legs are made straight at the right angle position. Now we can see here that in this image, what is not normal? We can see that there are extra folds in this leg and there is only one fold in this leg. So what we are going to document in this infant, first is ortholanus click. Now we know that ortholanus click will be heard when the knees and hip will be flexed and abducted. So this is not the ortholanus click. Limited abduction. Limited abduction, we can say that abduction is limited and not proper when we are going to abduct the legs. But here there is no abduction of the legs. Okay, abduction means that we are going to make the legs far from the center of the body. But there is nothing seen here. Talking about Gale-Aziz sign. So what is Gale-Aziz sign? Now we have discussed this earlier. Okay. So we can see here that Gale-Aziz sign is when we are going to make the baby lie in supine position and we are going to check the height of the knee. So one knee will be upward and one knee will be downward, and this indicates hip dislocation. Okay. So this is also not the Gale-Aziz sign. So what is this? This is asymmetric gluteal folds. So option number 4 is the correct option. This is asymmetric gluteal folds of the thighs. Now let's move to question number 7. The nurse teaches the parents of an infant with developmental dysplasia of the hip how to handle their child in a Pavlik harness, because the following is more appropriate. Okay, so a child, an infant who is having developmental dysplasia is using Pavlik harness. So let's see what is a Pavlik harness. So this is a Pavlik harness. What is the work? What is the purpose of this? So this is used to stabilize the pelvic area. Okay, so it is used in patients who have hip dislocation. Now, Pavlik harness is worn over a diaper. Knee socks are also worn to prevent the straps and foot and leg piece from rubbing directly on the skin. So the main intervention that we have to put focus on, that we have to always put cloth, that is we have to put diaper or socks or knee socks before putting the Pavlik harness. Why so? We don't want to injure our skin. Okay, so we are going to prevent rubbing of Pavlik harness directly on the skin. Now let's moving back to the question, which is the most appropriate for the baby who is going to wear the Pavlik harness. First is putting the diaper under the straps. So as we have already discussed, this is an important thing. Okay. Second is leaving the harness off by the infant sleeps. Now, Pavlik harness is very important to maintain the alignment of the hip. Okay, so we have to make sure that this is going to worn by the baby all the time. Okay, so we do not need to remove the Pavlik harness when the infant sleeps. So this is not the correct option. Now, option 3 is checking for skin redness under straps every other day. Now, checking the skin for redness or any kind of abnormality is very important, but not every other day. We have to check the skin for redness several times a day. Okay, not every other day. So this is also not the correct option. Option 4 is putting powder on the skin under the straps every day. Now, in an infant, in a newborn, there is no need to put any kind of powder or any kind of chemical or oil on the baby. Okay, so this is not the correct thing we should do. So what is the thing we have to do? What is the most appropriate thing that we have to fit the diaper under the strap to prevent skin from rubbing. Okay, so option number 1 is the correct option. Now let's move to question number 8. When developing the teaching plan for parents using the Pavlik harness with their child, what should be the nurse initial step? So we have to find the initial step that we have to perform when developing the teaching plan for parents using Pavlik harness. First is assessing the parents' current coping strategies. Option 2, determining the parents' knowledge about the device. Option 3, providing the parents with written instructions. Option 4, giving the parents a list of community resources. So as we know that a child is going to wear Pavlik harness. The most important thing here is that the parents should know what is Pavlik harness, how it is used, what measures the parent have to take care of. So the most important thing is knowledge about Pavlik harness. This is the initial thing that a nurse has to perform here. Now, first option says assessing the parents' current coping strategies. Now, coping is very important for the parents. Parents have to go back to home, they have to socialize. So, coping is very important so that parents can take a good amount of care for the baby. But is it the initial step? No. Coping strategies will have to be determined when the discharge plan is made. It is not the initial step. The initial step is determining the parents' knowledge about the device. This is the initial step because it is very important to use this device properly and with proper measures. So this seems to be the correct option. Option 3 says providing the parents with written instructions. Now, providing written instructions is important, but this will not be a initial steps. Also, what written instructions, it is not mentioned here. So we cannot take this question as a precise option. Okay. Option 4 says giving the parents list of community resources. Now we can provide community resources to the parents, but this is also not the initial step. So the initial step, the first step that we have to provide is that we have to provide a good amount of knowledge about the Pavlik harness. So option number 2 is the correct option. Now let's move to question number 9. When teaching the family of an older infant who has had a Spica cast applied for developmental dysplasia of the hip, which information should the nurse include when describing the abduction stabilizer bar? So in this question, the main thing is, the important thing is abduction stabilizer bar. So what is happening here? A nurse is teaching a family of an older infant who had a Spica cast. So, an infant is having a Spica cast applied for developmental dysplasia of hip. Okay, so there is dislocation of hip. Due to that, Spica cast is applied, and now the nurse is teaching the family about the abduction stabilizer bar. So, what information should the nurse provide while describing abduction stabilizer bar? First is it can be adjusted to a position of comfort. Option 2, it is used to lift the child. Option 3, it adds strength to the cast. Option 4, it is necessary to turn the child. So to solve this question, to choose the correct option, we have to know that what is the purpose of abduction stabilizer bar. So this is the picture of a child having hip dislocation. Due to that, this is the Spica cast, and this is the abduction bar. What do you mean by abduction? Abduction is moving the extremities far from the center of the body. So this is abduct position, and abduction bar is incorporated into the cast to increase cast strength. So what is the main purpose of the abduction bar? That this will increase the cast strength. Okay, and maintain the legs in alignment. So this is the role of the abduction bar. The bar cannot be removed or adjusted. Okay, so this is fixed by the physician, the doctor, and this cannot be adjusted by the parents according to the comfort. Unless the cast is removed and a new cast is applied, the bar should never be used to lift or to turn the client, because doing so may weaken the cast. So we have to make sure that we will not adjust the the abduction bar according to the comfort of the baby. So this is not the correct thing. Option 2 is it is used to lift the child. So lifting the child is not done through the abduction stabilizer bar. So it is not also the correct option. Okay. Option 3 says it adds strength to the cast. So this is the correct option. Option 4 says it is necessary to turn the child. So this is not used to turn the child. So clearly the role of the abduction stabilizer bar is to add the strength to the cast and to maintain the legs in alignment. Now let's move to question number 10. A mother asked the nurse about using a car seat for her toddler who is having a hip spica cast. Okay, the nurse should tell the mother, you can use a seat belt because of spica cast. Second is, you need a specially designed seat for your toddler. Option 3, you can still use the car seat you already have. Option 4, you need to get a special release from the police so that a car seat won't be needed. Now, we have already seen that a hip spica cast contains a abduction bar. Okay, so abduction bar is a lengthy thing and it needs a lot of space in the car. So using a car having seat already she have is not the correct option. It is clearly not the correct option because this abduction bar needs a good amount of space. Now let's see option number 1. You can use a seat belt because of the spica cast. Okay, so this is not the correct option. Seat belt cannot be applied to the baby as there is a lot of space that is going to take by the abduction bar. Option 2 says you will need a specially designed car seat for your toddler. So this is the correct option. A mother need to specially design car for her baby to make the baby sit in the car. Option 4 says you will need to get a special release from the police so that car seat won't be needed. Now this is unnecessary here. To remove the car seat is not the correct thing that we are going to do. So the thing we are going to do is we are going to tell the mother that she need to specially design the car seat for her toddler. So option number 2 is the correct option. Now let's move to question number 11. The nurse is discharging a baby with clubfoot who has had a cast applied. The nurse should provide additional teaching to the parents if they state. So, a baby who is having clubfoot is going to discharge and the nurse should provide additional teaching to the parents if they state. So, we have to choose the option which tells that parents do not have sufficient knowledge about this condition. Option 1 says, I should call if I see changes in the color of the toes under the cast. Now this seems to be the correct option. If there is change in the color of the skin under the cast, then this has to be informed. Okay. Option 2 says, I should use a pillow to elevate my child's foot as he sleeps. Okay. Option 3 says, my baby will need a series of casts to fix her foot. So this is also the correct thing. Baby will need at least 5 to 10 times cast changing to fix her foot. Option 4 says, having a cast should not prevent me from holding my baby. So if baby have club foot or if baby is normal, there is no need to prevent holding. Parent can hold their baby as much as they want, even if there is club foot. Now focusing on option 2, it says I should use a pillow to elevate my child's foot as he sleeps. Now elevating foot of the child will be done if there is any kind of edema. Okay, if there is any kind of swelling, then elevation is done. Now, the thing here we have to put focus on sudden infant death syndrome. This is a very important thing that we have to always remember while solving PEDS question. Why? Because Sudden infant death syndrome happens when we apply pillow or any kind of barrier in the cot. Okay, if we provide any kind of pillow around the baby in the crib, then this can lead to sudden infant death syndrome. It is the sudden and unexplained death of the baby younger than 1 year old. Most sudden infant deaths are associated with sleep, which is why it is sometimes still called crib death. So what happens here, due to placing of pillows or any kind of blankets in the crib of the baby, what occur? Baby inhale his own carbon dioxide. So there is not a proper exchange of oxygen and carbon dioxide in the environment. So what happens? Baby inhales his or her own carbon dioxide. This leads to increased CO2 level in the body. Okay, and this lead to sudden infant death syndrome due to sleep apnea. So using pillow in the crib of the baby is not recommended. So option 2, if stated by the parents, need additional teaching. Now let's see what is clubfoot. So this is the clubfoot. So a birth defect in which the foot is twisted out of shape or position. In clubfoot, the foot appears twisted and can even look as if it's upside down. Okay, so there will be abnormal twisting of the foot. So we will choose option 2 as the correct option. Now let's talk about question number 12. The parents of a neonate born with congenital clubfoot express feelings of helplessness and guilt and are exhibiting anxiety about how the neonate will be treated. So, which of the following actions by the nurse will be most appropriate immediately? Now, in this question, it is clearly mentioned that parents are having a feeling of helplessness and guilt. They are exhibiting anxiety. So, here, nurse plays the greatest role. This is the work of nurse to provide empathy to the parents about this condition. So, what is the appropriate action that a nurse should perform initially? First is ask them to share these concerns with the primary care provider. Now, as I have said that providing concern, okay, showing concern, showing empathy, and solving doubt is the priority thing that should be done by the nurse. So there is no need to ask them to share these concerns with a primary care provider. A nurse can resolve this issue by herself. So option number 1 is not the appropriate action that should be done by the nurse. Option 2 says arrange a meeting with other parents whose infants have had successful clubfoot treatment. Now this is a big thing that can be done for these parents, but this is very important so that they have a role model. Okay, but this is not the initial thing that should be performed for these parents. The initial thing that they should perform, they should discuss the problem with the parents and the current feelings that they are experiencing. As we know that parents are having anxiety, guilt, helplessness, so we need to tell the patient to verbalize their feelings. Okay, we need to tell the parents to verbalize their feelings. So this will ventilate their feelings and anxiety will be reduced. Okay, so we can tell the parents to share their view, to clarify their doubts and verbalize their feelings about this condition. Okay, this is the initial thing and appropriate thing that a nurse should do. Option 4 says suggest that they make an appointment to talk thing over with the counselor. So this is also important, but it is not the initial step. Okay, so option 3 is the correct option, and this is the initial and appropriate step performed by the nurse, that she should discuss the problem with parents and current feelings that they are experiencing. Now let's move to question number 13. Question number 13 says, after teaching the parents of an infant with clubfoot requiring application of plaster cast how to care for the cast, which of the following statements would indicate that the parents have understood the teaching? Okay, so we have to choose a statement that indicates that parents have understood about the application of plaster cast and how to care for the cast with the baby of clubfoot. First option says, if the cast becomes soiled, we'll clean it with soap and water. So, if the cast becomes soiled, is there need to clean the cast with soap and water? Clearly no. Okay. So, applying soap and water on the cast will reduce strength of the cast. Okay. So, it is totally not recommended here. Option 2 says, we'll elevate the leg with the cast on pillows so the leg is above heart level. Okay. So, elevating leg with cast on pillows is important, but it will be only done if there is edema. As I've already told that we do not need to give pillow to the infant unnecessarily. It can lead to sudden infant death syndrome. Option 3 says, we will check the color and temperature of the toes of the casted leg frequently. Now, this option seems to be the correct option. Why? Because we know that cast is applied on the foot. Now, there can be any kind of interruption in the blood supply due to cast. Okay, in rare cases, there can be necrosis also. So, it is very important to check for the color, to check if the color of the skin become blue. Okay, and we have to always check the temperature of the toes if toe has become cold. Okay, so these indicate that there is some kind of neurovascular impairment. So frequently checking this would indicate that parents have understood about the care of the cast. Option 4 says the petals on the edge of the cast can be removed after first 24 hours. Now, what are the petals? So when a cast is applied on the leg, so let's assume that this is a leg of the baby and this is the cast applied. So at the edge of the cast, there are some bandages applied at the edge, and this is done to prevent skin damage. Okay, so it is done to prevent skin damage. So petals should not be removed after for 24 hours because they are protecting the skin from damage. So option 4 is not also the correct option. So option 3 is the correct option that says that we will check the color of the temperature of the toes of the casted leg frequently. Now let's move to question number 14. Before that, let's read what this says about this question. So a cast that is too tight can cause a tourniquet effect. Okay. So a tourniquet effect can be seen when the cast is too tight, compromising the neurovascular integrity of the extremity. Manifestation of neurovascular impairment include pain, edema, pulselessness, coolness, altered sensation, and inability to move the distal exposed extremity. So it is very important to assess the changes for neurovascular integrity. Now let's move to question number 14. A father of a preschool age child with a tentative diagnosis of juvenile idiopathic arthritis. So tentative means the diagnosis is not definitive, it is not confirmed, and it is only guessed. Okay. Now the father of a preschool age child asked about the test to definitely diagnose GIA. Okay, so here in this question, I wants to know that what test could tell that juvenile idiopathic arthritis is confirmed. Okay, so what test will tell that this disease is confirmed? Then what response the nurse has to provide for this knowledge? Okay, so let's see. Option 1 says the latex fixation test is diagnostic. Option 2 says an increased erythrocyte sedimentation rate is diagnostic. Option 3 says a positive synovial fluid culture is diagnostic. Option 4 says a no specific laboratory test is diagnostic. Now, the latest fixation test diagnostic, latest fixation test is used to confirm diagnosis of arthritis, but it is not correct in 90% cases in the case of children. Okay, so in juvenile age, it is not going to provide positive results 90% of the time. So it is not a definitive diagnosis for this condition. Second is increase ESR in this condition. So increased ESR will not confirm juvenile idiopathic arthritis. It is not commonly seen that ESR will increase in this condition. So option 2 is also not the correct option. Option 3 says a positive synovial fluid culture is diagnostic. Now, positive synovial fluid culture means that there will be some presence of bacteria. Now, presence of bacteria indicates septic arthritis. But in the question, there is no hint of septic arthritis. Okay, so checking the synovial fluid culture is done in septic arthritis, not in juvenile idiopathic arthritis. So we have to tell the father that there is no specific laboratory test that is used for definitive diagnosis of this condition. So option number 4 is the correct option. Now let's move to the last question of this video. Let's see, the latex fixation test, which is commonly used to diagnose arthritis in adults, is negative in 90% of children. So what occurs in latex fixation test, that in this method, mix blood with tiny rubber beads that are covered with human antibodies. If RF is present, the latest beads clump together, that is E-glutamate. This method is best used as first-time screening for rheumatoid arthritis. So it is not recommended in juvenile idiopathic arthritis. Now let's move to the last question. The parents of a child just diagnosed with juvenile idiopathic arthritis tell the nurse that the diagnosis frightens them because they know nothing about the prognosis. What should the nurse include when teaching the parents about the disease? So this question tells that parents wants to know about juvenile idiopathic diagnosis. So what we have to tell about this disease? First is half of affected children recover without joint deformity. Option 2 says many affected children go into long remissions but have several deformities. Option 3 says the disease usually progresses to crippling rheumatoid arthritis. Option 4 says most affected children recover completely within a few years. So what is the correct thing we have to tell about this condition? So let's see. So juvenile idiopathic arthritis, it is a autoimmune, non-infective. It is an autoimmune, non-infective, inflammatory joint disease that cause of which remains poorly understood. This is characterized by chronic joint inflammation. It is most common chronic rheumatic disease of childhood affecting approximately 1 per 1,000 children. Juvenile refers to disease onset before 16 years of age, while idiopathic refers to condition with no defined cause, and arthritis is inflammation within a joint. So, in half of the children, diagnosis with juvenile idiopathic arthritis occurs without joint deformity. Approximately one third of children will continue to have disease to adulthood, and approximately 1/6 will experience several severe crippling deformities. So, which means that only half of the children are going to recover without having any joint deformity, which is a good thing, okay? And very less amount of children will have further severe condition. So option number 1 is the correct option, and we have to tell the parents that half of the children recover without joint deformity. So option number 1 is the correct option. Okay, so option number 1 is the correct option, and we have to tell this to the parent. So we have discussed 15 questions. I hope each question was clear and rationals were clear and appropriate. If there is any doubt, let me know in the comment section. Now we will meet in the next video. Till then, keep practicing the questions. Bye-bye.